Okay, good afternoon, all. I believe we are all back, eating and refreshed. We are going to continue with public health before Dr. Mariam also take the second part of her lecture. This morning, we discussed biostatistics, and now we will continue with general practical community medicine. Okay, and after the lectures for today, we will upload all the slides, but the videos as we of the lectures that we are covered are already uploaded. So we are going to be answering some questions in the form of picture tests, and later a separate document will be uploaded that is carrying all the answers for this. Okay, the first question here, this is the external genitalia of a male, and he's presenting with a milky urethral discharge. This milky urethral discharge in male is commonly seen in sexually transmitted diseases, and the commonest type you see is when a patient contracted an infection from Neisseria gonorrhoeae. And usually they present with a burning urethral discharge and discomfort while micturating. The question says, what is the causative organism in this condition? And the syndromic management of the condition. Now, the commonest organism is Neisseria gonorrhoeae, that it causes a milky urethral discharge. You have burning sensation as well as discomfort while micturating. Now you have chlamydia, and chlamydia can also cause that. Trichomonas vaginalis, which it's common in female. However, it can still occur in male, presenting with similar urethral discharge. And also Candida albicans can present with this form of discharge. So when you see an image like this of an external genitalia with a milky urethral discharge, you know it's a sexually transmitted disease presenting such, with the commonest organism being Neisseria gonorrhoeae. Okay. Now, the questions, the B question says, what is the syndromic management? Now, usually the symptomatic presentation are treated, okay? Now, for the urethral discharge, antibiotics are administered, and the antibiotics that are commonly used include the metronidazole for the trichomonas. You use doxycycline for the chlamydia trachomatis. The fluconazole is used for candida, and the Neisseria gonorrhoeae, you have ciprofloxacin, which is a quinolone. Okay, it's a broad spectrum antibiotics. So ciprofloxacin, okay, is administered. Now, when the patients have lower abdominal discomfort, you give analgesics. So the first treatment, one, you give antibiotics. Two, analgesics. Now, for the lower abdominal pain that they may have, and you can also give antispasmodics. Now, how is this prevented? Of course, you use protection during sexual intercourse. And also, you don't only, if you don't treat the partner of this patient, is going to be recurrent. So when a patient has this urethral discharge, sexually transmitted, you don't treat only one of the partner. Okay, you have to treat both. And as well, there's what is called contact tracing. You do contact tracing where the exposed individual is located, okay, and also treated. The other exposed partner is located and treated similarly, okay, and you counsel both for use of protection, okay. Now, what are the complications that can arise from this? You should know patient presenting with purulent, this is called purulent urethritis. They tend to develop a complication, urethral stricture. This is a complication of purulent urethritis, and this urethral stricture can occur in like 10 to 15 years. It's not something that occur immediately. It occurs like 10 to 15 years after patients developed this purulent urethritis. Okay. Now, because of fibrosis and all that pathogenesis that occur, subsequently they develop such complications. So one, when you see it, remember that the commonest organisms are Neisseria gonorrhoeae, Chlamydia trachomatis, Trichomonas vaginalis, and even Candida albicans. So the commonest being Neisseria gonorrhoeae. And you do symptomatic treatment. You give antibiotics, broad spectrum antibiotics. You give analgesics, antispasmodic. You do counseling, contact tracing, as well as what do you call it? Use of protection. Now, the next question is showing a refuse. You can see a refuse here. What type of refuse disposal is this called? You can see this open dumping. This is something that is common in our society. Okay, you just see open dumping by the side of the road, and it accumulates. In fact, this is a very common environmental pollution. So the question here, what type of refuse disposal is this? Just when you see open dumping, the option, okay, is the type of. Then mention 5 hazards of this method of refuse dumping. Now, of course, you know, when you have open dumping, there's environmental pollution. Okay, it could be, so one, when you see open dumping, there's environmental pollution. 2, there's breeding of rodents. 3, okay, you have fly nuisance. And of course, these fly nuisance can transmit diseases. So there's transmission of diseases like cholera and so on. Then 4, they can cause domestic accidents. 5, and very important, blockage of drainage. Okay, blockage of drainage. So you should know this open dumping is an environmental pollution. They can breed rodents, fly nuisance, both rodents and fly nuisance. They can all cause disease transmission. They can all cause disease transmission. Now, the next question says, list 5 sanitary methods of refuse disposal, 5 other methods of disposal. Okay, 5 methods of refuse disposal. Now, there is landfilling. You can call it sanitary land, okay? Or some call it control tipping. Now, what is done here, refuse are used to fill, okay, land where there are a lot of, where some places where you have some land that have been eroded, excavated, you use the dumping to fill that. But the bottom line here is you don't just dump the refuse and leave it like that. No. In land filling, after filling that eroded soil, you have to fill the refuse with another layer of soil or soft sand so that there will be no spread of diseases. Because if you just take the dumping there and leave it open, the fly nuisance, breeding of rodents, environmental pollution from smell and all that will still continue. So after filling, you have to cover with. Okay, there's composting. Composting is use of organic matter. Use of microbes to cause decomposition of organic matter. Okay, that is composting. Composition. You have composting or incineration. You have composting or incineration where you use heat, flame to completely burn off the you completely burn off the wastes. So, yes, there could be burying. So we have sanitary landfilling, composting, incineration or composting. Then what again? Yes, pulverization. Okay, use of chemicals, okay, to decompose materials. So the question is on refuse dumping. And one important thing you should take note of is spread of diseases. Okay, spread of diseases. Take note of that. So let's continue. The third question says, you can see this picture is of a teenage pregnancy. Okay. The pregnancy in this teenage girl, okay, formerly a student, results from unplanned sex. What action could she take after the sexual intercourse to have avoided her current situation? Okay. B says, name one health promotive and rehabilitative services that she needs in her condition. Okay. Now, the first question is what could she have taken after sexuality? There's what is called emergency contraception. Okay. So she would have taken an emergency contraceptions where progesterone pills are taken after unplanned sexual intercourse to prevent unplanned pregnancy. Look at the question. It says after, okay? Because it's something that happened unplanned. But if it is planned, of course, she can use protection. But it's unplanned, you have to be very careful in answering the question. When it has already occurred, she has to use emergency contraception, emergency contraceptive. Now, name one health promotive and rehabilitative service that she needs in her condition. Of course, it has already happened, okay? So to promote her health, you prevent anemia, okay? Prevent other complications that can occur during pregnancy. So you give folic acid and iron supplements, okay? Proper and adequate nutrition. Then you encourage good personal hygiene. So health promotive measures: one, prevention of anemia by giving iron supplement and folic acid. Two, adequate nutrition. And three, you have to encourage personal hygiene. So these are the health promotive measures you want to take. The second question says, name one health rehabilitative, what are the rehabilitative services that she needs in her condition? Now, you should know that the rehabilitative needs will include occupational, okay? And you know, most of these young teenage, when something happens like this, they are abandoned. And this will lead to a lot of all the problems you are afraid of. All the complications, she will face all the complications of pregnancy. So it has happened. So you have to empower them. So she needs occupational rehabilitation. She needs some psychological and social rehabilitation because she can go into depression, attempting to commit suicide, and so many other bad thoughts can be coming to her. Okay, so she needs the rehabilitation. She needs one, occupational; two, she needs psychosocial; and she needs social rehabilitation. Now, most of these things are applicable to some other conditions. Okay, let's move on. Number 4, this picture is of a mosquito. Now, the question here says, list 4 ways of controlling vectors. List 4 ways of controlling vectors. When you controlling vectors, you have environmental management. Environmental management or environmental control, because if you have a lot of stagnant water, these vectors can breed. If you have a lot of bushes, they can breed. So you clear stagnant water by encouraging drainage. You avoid excessive bushes and prevent open dumping. So 1, environmental management. 2, use of insecticides. Use of insecticides. We shall talk about the types of insecticides shortly. Then 3, you want to do biological control. So where you use other organisms to feed on some stages of their life cycle. Okay, like you use tadpole in a stagnant water to feed on the larva of mosquito. That is a form of biological control. Okay, then there's mechanical control, which involves physical removal of any vector or any stage of their life cycle. So these are 4 ways you can control vector: environmental control, use of insecticides, biological control, or mechanical control. Now, the next question says, you should list 5 diseases transmitted by mosquito. List 5 diseases transmitted by mosquito. This is a common This is a common question in your exam. Mosquito. Okay. Of course, number one, the malaria. That is the common one. Okay. Malaria. Transmitted by which type of mosquito? Anopheles mosquito. Yellow fever. Diarrheasis. Dengue fever. Dengue fever. Oasis. Okay. So these are disease conditions that are all transmitted by mosquito. So when you see mosquito, they can ask you on how to control it, as well as diseases that are transmitted by this. Now, these are some kind of images you see in the exams that causes dilemma. Don't say food flags. You see a cooler, you start saying food flags. Okay. What is this? Then the other question. Now, the reason why sometimes these questions are difficult because they are multiple choice questions. You will now be wondering what is food flags doing there. But if it's something to write short notes on, you will get you will get a clue. Like from this B says, list 5 other cold chain equipment for ensuring delivery of potent vaccine to the people. So when you see this, you already know it's all about maintaining a cold chain. Okay. So your answer here is vaccine carrier, not food flags. Okay. Two, it says list 5 other cold chain equipment. 5 other cold chain equipment for ensuring delivery of potent vaccine to the people. Okay, you have cold box. 2, ice pack. Yes, ice packs. 3, refrigerator. Of course, in our region, you'll be talking about generator. Because if the light is staying for a very long time, more than expected, even you will be wondering. So you have generator as part of the equipment we require to maintain. After generator, they said 5, then you have cold room. So when you see something like this, like a cooler, is vaccine carrier. Okay. Now, I believe some of you have this card, the yellow fever card, the yellow card. Okay, identify the specimen. You can see it's written Federal Republic of Nigeria, International Certificate of Vaccination. Okay, Certificate of International, this in French. Okay, so it's a vaccine, it's a yellow card. Now, name 2 types of vaccine used by this specimen, the yellow fever, the hepatitis. So this is a vaccine card. So you have or the yellow card, sorry. You have yellow fever and hepatitis. Okay, the next question, name two types of flags used on a ship. Two types of flag used on a ship. Now, these flags are called the Q flag, okay? You have the yellow flag. The Q flags, this yellow flag, when you see a yellow flag on a ship, what it means is that that ship requires clearance. It has not been checked, okay? So you cannot verify whether it is carrying an infected or it is safe, but it requires verification, okay? It requires verification at the port. So there are two types. It could either be QQ or QL. This is what they are asking you. QQ or QL. So the QQ is the blue flag and the QL is the red flag. So the QQ, which is the blue flag, it means it has been cleared, okay? There is no need, there's nobody quarantined there, so the ship can be approached, okay? So the red flag, it means it is carrying an infected individual that needs to be quarantined, okay? So that ship is not approached. So you have the question says you should name two types of flag on a ship. So you have the blue flag, which is the QQ flag, and the red flag, which is the QL flag. Okay. Let's go back to the question. Okay. What is this? You can see a child with rashes, okay, all over her head and neck and the chest. And if you look at her eyes, she has conjunctivitis. So, and this is likely a measles. So you are asked, what is it? Okay, this measles. Now, measles have some diagnostic features you need to know. List three diagnostic features of this condition, okay? List three diagnostic features of this condition. The three diagnostic features include one, the Koplik spots, this darkish tiny spot you are seeing, the Koplik spots. Two, look at her eyes, she has conjunctivitis. And three, she has maculopapular rashes. So the three diagnostic features of measles are Koplik spot, conjunctivitis, maculopapular rashes. The C question says, Mention the most important strategy for control. The most important strategy for control of measles is the use of measles vaccine. So C is measles vaccine. Okay. So measles vaccine. Then D says, mention one important micronutrient that gives the child, that is given to child with this condition. Okay. The important micronutrient that is given to a child with measles is vitamin A. So please take note of these questions. They are common questions that come around measles in picture tests for public health. You should know this common presentation. You should also know the best means, the most important strategy of control, and also the micronutrient that is given, which is vitamin A. Now, this picture, what is the radiological feature seen in the picture? What is you can see a child with prominence, okay, with prominence of bones, chest, ribs. Then the next question says, what is the cause of this condition? Now, this is rachitic rosary, a pathognomonic feature seen in rickets, which results from deficiency of vitamin D. Okay, so what is the radiological feature seen in this picture? Okay, it's rachitic rosary, just like beads. Okay, what causes this condition? What causes rickets? Is vitamin D deficiency. Okay, so this is a very straightforward question. Now, this is a picture of a child breastfeeding. A picture of a child breastfeeding. Now, breastfeeding contributes to mortality reduction in children. Of course, A says, what two most important advice will you provide, okay, to a recently delivered mother about breastfeeding? Okay. Two most important advice will you provide a recently delivered mother about breastfeeding? Then B says, list 4 signs of good positioning during breastfeeding. And C says, list 4 signs of good attachment. So this is a very important question, because while counseling a breastfeeding mother, you need to educate her on all these things. If you don't know this, you will miss all the marks. So the first question says, two most important advice you provide a recently delivered mother about breastfeeding. Okay, you tell her one about exclusive breastfeeding. Exclusive breastfeeding for the first 6 months. Then you now add appropriate complementary feeds from 6 months, okay, up to the second birthday. Because after 6 months, the breast constituent alone will not be sufficient for the child metabolic need. Even the iron and other nutrients in the breast will not, in breast milk, will not suffice the metabolic need of a child that is growing beyond that age. So you have to add other supplements, okay? So number 2, you have to encourage breastfeeding, okay, on demand. You know, a child is not like adults. You say you want to give the child breakfast, lunch, and dinner. You just kill that child, okay? Just give the child anytime the child wants breastfeeding, because that is the only way a child communicates, by crying. When the child cries, breastfeed the child. Don't say, no, it's not lunch time. You are going to starve the child and the child will have malnutrition, okay? So encourage her to breastfeed on demand. And how does a child demand? Is by crying. That is their means of communication. 3, okay, it is said, we said 2. So you ensure firm attachment while breastfeeding. This is also another advice, firm attachment while breastfeeding. Now, the next question says, list 4 signs of good positioning. List 4 signs of good positioning. Okay, let's see all these signs. Number 1, okay, let's good signs or signs of good positioning. Now, number 1, the mouth of the baby should cover the areola as much as possible. So mouth of the baby should cover the areola as much as possible. Not just the nipple, because they have to be that firm attachment to generate an adequate suction pressure for suckling the child. Okay, so 2, the head, neck, and the buttocks of the baby should be at the same level. Head, neck, and buttocks should be at the same level. Okay, head, neck, and buttocks should be at the same level. So 3, the baby should take the breast, not the breast. The baby should be taken to the breast, not the breast to the baby. So the mother must hold the child and bring the child towards the breast, not that you just leave the baby down and you are taking the breast to the baby. Okay, baby should be taken to the breast, not okay. Number 4, the mother should comfortably sit down, okay, and resting and supporting her back. Okay, so mother should sit comfortably, supporting her back. Because if the mother is not well seated and comfortable, she will be fatigued, and of course she will not breastfeed the child properly. So you should take note of all these 4 points. The mouth of the baby should adequately cover the areola as much as possible. The head, neck, and the buttocks of the child should be at the same level. The baby should be taken to the breast, not the breast to the baby, and the mother should sit comfortably, supporting her back. Now, the next question is signs of good attachment. When a baby is suckling, what are the signs of good attachment? Signs of good attachment during breastfeeding. Okay, what are these signs? Number one, no pain to the mother. No pain to the mother. Two, there should be a rounded cheek. Rounded cheeks. Because if the cheek is not rounded, it means the child is struggling to suckle and is not well, the mouth is not well positioned on the nipple areola. So when it is well positioned and there's no any form of straining or discomfort, you will see a rounded cheek. Okay. In fact, you shouldn't be hearing that sound. When you are hearing that hissing sound, the child suckling, it means air is just going in between that cheek and the lips. The child is not well positioned. Okay. Now the suckling is initially, okay, is initially turning, it should be turning to slow deep suck and swallowing. Okay, they are suckling initially. Okay, rapid suckling initially. So later you see the child, it transforms to slow deep suckling and swallowing. Okay. And mark you, when the child is suckling throughout and you are hearing that sound, the mother is not suckling the child properly. Okay, we've answered, okay, important advice, positioning, and good attachment. The next question is, what group of insecticide does the shown picture belongs to? What groups of insecticide? I said we will talk about insecticide. Then what other group of insecticide exists? Now, you know some insecticide, okay? They could be non-residual and residual. This has to do with the duration of that insecticide on a surface. Now, non-residual have short durations on surfaces, while long duration insecticide have a very long, or residual insecticide have long duration. Even some days after application of residual insecticide, an insect crawl over that surface, it will still kill the insect. So there are two types, non-residual and residual. Okay, so the duration for non-residual, the duration of contact on surface is short, while for residual, the duration of contact to surface is long, for days. Now you can see this insecticide that is shown here is a non-residual insecticide. The duration of contact on surfaces are short, okay? The residual ones are compounds like organophosphates, carbonates, okay? Organochlorines, they are all long contacts. And this long contact, you see sometimes they are applied for crawling insects, where you just sprinkle them on the floor, apply some on the wall, and they are there for some period. When the crawling insects come in contact, it kills them. So this particular one is a non-residual type. Okay. The next question is showing a child, okay, having some form of stiffness. Well, it's image, not video. They are having spasm. Okay, you can have neonatal tetanus. You'll see child having generalized spasm, okay, or local spasm. Neonatal tetanus. What is the first symptom that this baby is likely to have presented with? Okay, poor suckling. Now, in adults, what is the first symptoms they present with is trismus. Okay, facial spasms, spasms of facial muscles. Okay, okay. Now, in children, neonatal is refusal to feed. So that facial spasm, they will just refuse to feed. Now, the second question says, how many doses of vaccine is ideally recommended for females to prevent this condition in babies? Okay, you have 5 doses. How many doses of vaccines are recommended to prevent, for females to prevent these conditions in babies? So you have 5 doses. 5 doses are recommended. You have tetanus TT1 to 5. And what you should know about tetanus toxoid is an active immunization. Tetanus toxoid is an active immunization, while the immunoglobulin for tetanus is a passive immunization. The immunoglobulin is a passive immunization, while the tetanus toxoid, the toxoid is active immunization. So what is the difference between active and passive immunization? Active immunization is stimulating the host to produce antibodies. You give a toxoid or an antigen, it stimulates the host cells to produce its own antibodies. That is active immunization. And it is more long-lasting. Passive immunization is giving a preformed antibodies for that immediate neutralization. Okay, so it's just a short-term immunization. but active immunization stimulates the patient to produce, or the host to produce, its own antibody. So let's see these 5 doses that are given. Now, the tetanus toxoid 1 is given as, okay, first contact. So what's protection? What is the percentage protection it provides? Okay, it's none. It doesn't provide any protection. You should know this. The one that is given at first contact, since it's toxoid, remember, I told you what does toxoid do? Is an active immunization. It only stimulates the host to produce its own antibody. So when the mother goes there to receive the toxoid, you give her, it will not give any protection. What duration? Duration of action? None. Because from there, the mother will start producing its own antibody. So that is TT1, the first toxoid that is given at first contact with the mother. So the second toxoid that is given, okay, it's given at least 4 weeks after the first toxoid, after the first tetanus toxoid. And what is the percentage protection it provides? It provides 80% protection. And what is the duration of protection of the second tetanus toxoid? Is 3 years. 3 years. Then the third one, tetanus toxoid 3, okay? When is it given? At least 6 months after second tetanus toxoid. What is the percentage protection it now confers? 95% protection. What is the duration of protection it gives? It gives a duration of 5 years. Okay. Then the fourth one, tetanus toxoid, is given 1 year after the third tetanus toxoid, 1 year after. And what percentage protection the fourth provides is 99% protection. What is the duration of action? 10 years. And lastly, the fifth tetanus toxoid is given at least 1 year after the fourth tetanus toxoid. At least 1 year after the fourth tetanus toxoid. And what is the protection? 99%. And you can call it a lifetime protection. So the protection is for life. You can see why you need to give 5, because if you give only 4, it will give you a 10-year protection. So all these things we mentioned, you need to know them in when you are talking about tetanus. Now I'll give you an assignment. You quickly check after the class. You need to, regarding tetanus, you check incubation period of tetanus. onset time. What is onset time of tetanus? What is incubation period of tetanus? What is trismus? What is rhizus sardonicus? All these are related to tetanus. Okay. The incubation period, the onset period. Okay. So you need to know which one is between the transmission of the infection and development of symptoms, between the development of symptoms and the presentation of first spasm, okay? Then the devil's facial smile appearance. Okay, let's proceed. We have a lot to cover. Okay. Now you can see this child, which are an image of some rashes, some crusts on the rashes that looks like discharge, okay? And some areas have blisters. There are rashes on the hand, some are crusted, some have blisters, okay? And some are peeling off. The question here says, what is the diagnosis? What is the causative agent? What is the most important risk factor? How will you treat this condition? And what else will you do to prevent recurrence? Now, this infection is called scabies. Scabies or infected scabies, because in infected scabies, you'll be seeing some discharge, some whitish purulent collection. So this is scabies, and the causative agent is sarcoptic scabies. Sarcoptes. Okay. Now, what are the risk factors? What are the risk factors? The risk factor is overcrowding. What is the most important risk factor for scabies is overcrowding. Okay. Then how will you treat the condition? Topical antibiotics, benzyl benzoate lotion, and antihistamine. Because of the itching, it has a profound itching. How will you prevent recurrence? Okay, how will you prevent recurrence? You wash any beddings, any contact, whether mites, ticks. Okay, this is how you spell it. Okay, now you have to, all your towel, clothing that have been contaminated, how do you wash them? Wash them with hot water. You have to wash them with hot water. Then you now thoroughly dry them. You thoroughly dry them. Sorry for that short break. Okay, so those beddings, clothings are washed with hot water and they are thoroughly dried. Now, that is one. Then two, you have to do contact tracing and give prophylaxis. Those patients that you have had contact with, that has had contact with patients with scabies, you have to give prophylactic. What do you give? Ivermectin. Okay, then you treat the individual. Let's take a 2-minute break. Okay, so let's continue, please. Now, the next question. Let's see the next question. Okay, Helicobacter pylori. Okay, Helicobacter pylori. What condition is this mainly associated with? Who established the association? Okay, this Helicobacter pylori is the most important causative agent for peptic ulcer disease. Is the most important causative organism of peptic ulcer disease. So it's associated with peptic ulcer disease. Now, treating peptic ulcer disease without that is associated with Helicobacter pylori, without eliminating this, you are just wasting your time. There's going to be recurrence. So when you are treating peptic ulcer disease, you have to target Helicobacter pylori by giving antibiotics. You have to target acid production by giving a proton pump inhibitor. Okay, so you use commonly triple therapy. For the first line treatment, you use triple therapy, antibiotics and proton pump inhibitor. The next question is on history. Who established the association of H. pylori and peptic ulcer disease? Let me leave that as an assignment. The association between peptic ulcer disease and H. pylori is Barry Marshall. Okay, Barry Marshall. And so if it's, since it's MCQ, you see it. When you see a name like this, you know the correct one. So Warren, Robin Warren, in 1982. In 1982, okay? In 1982 in Australia. So Helicobacter pylori is associated with peptic ulcer disease. Now, this is a water dam. I remember in your last exam, somebody was telling me that he saw pure sachet water. Okay. The problem with this picture test in ComMed, you just, if you don't have an idea what they are asking for, you just be wondering what is sachet water doing on my picture test. Now, this is water dam. What are the stages of water treatment in sequence? B, what is the most common form of water disinfection? Okay, now what are the sequence? What is the sequence of water treatment? Now you should know that for any form of treatment, you have to protect the source. Protection of the source is one important. You can't be treating water when from the source there is ongoing contamination. So number one, you have protection of source. Number two, collection. Okay. Number three, storage. Number four, okay, sedimentation. And number five, you have filtration. This sedimentation is also called coagulation, okay? And lastly, the final and most important stage is disinfection. And the disinfection is achieved via chlorination. Disinfection is achieved via chlorination, okay? Disinfection. So if you are asked stages, or you should know the stages of water treatment: protection of source, collection, storage, sedimentation, filtration, and disinfection. Now, what is the common form? We already mentioned that chlorination is the most common form of disinfection. Okay. Now you can see these iodized salts. You'll be wondering, salts, list 5 micronutrients. List 5 micronutrient diseases of public health importance. This is an important question. Micronutrient diseases of public health importance. Number one, you have night blindness from vitamin A deficiency. It causes night blindness. Okay. Number two, you have iodine deficiency causing what? What is the disease? Endemic goiter. And endemic goiter affects up to 10% of the population in the community. Endemic goiter affects up to 10% of the population in the community. Okay, number three, iron deficiency. Iron deficiency, okay? it causes microcytic hypochromic anemia. Microcytic hypochromic anemia. Then number 4, sorry, where are we? Number 4, wow. Number 4, vitamin D deficiency causing rickets. Vitamin D deficiency causing rickets. Number 5, folate deficiency causing neural tube defects. Folate deficiency. Now, please remember the five micronutrient deficiency of public health importance. Vitamin A deficiency causing night blindness, iron deficiency causing endemic goiter, iron deficiency microcytic hypochromic anemia, vitamin D deficiency causing rickets, folate deficiency causing neural tube defects. So, okay, you can add thiamine deficiency causing wet beriberi. So these are of public health importance. The next question says, mention the 3 broad strategies for control of micronutrient disorder. Mention the 3 broad strategies for control of micronutrient disorder. So number 1, food supplements with synthetic forms of micronutrient, food fortification, and dietary diversification. So you have food supplementation, food fortification, and dietary diversification. Fortification, supplementation, and dietary diversification. Those are 3 broad strategies for control of micronutrient deficiency. Okay. Now, the next question says, what is the cause of these states? Okay. Now, is severe dehydration. You can see the eyes, sunken eyes, baby is lethargic. You have prominent ribs. They have loss of skin to go. You can see how the skin of the belly of this child is pinched and there is loss of tugor. It is not returning to its previous state after pinching. So this is loss of skin tugor. Now, approximately what percentage of under 5 mortality is due to this condition, is due to dehydration? Okay, you should know that up to 16% of under 5 mortality are due to severe dehydration. List 3 rules of home management of diarrhea. List 3 rules of home management of diarrhea. Hand washing, number 1. You know, hand washing is the most effective means of preventing disease transmission, hand washing. So, home management. 2, continuing breastfeeding. And 3, use of ORS, oral rehydration solution. Okay. next question here. What is the relationship between doctor's density and mortality ratio? You can see the curve as the density is reducing, maternal mortality is increasing. Okay, what type of tests will you use to determine the statistical significance of this relationship? Okay, let's don't go into that. You can use chi-square. Okay, now number 18. Let's see what this is all about. What pattern? Okay, other than graphical method, list 3 other methods for the presentation of this data. Weights and months of after delivery. This weight pattern of undernourished mothers 2 to 6 months after delivery. So aside using this, what other methods can you use? Okay, this is this is spot diagram. Later it is now plotted. You can use other method of data representation. You can use tables, you can use charts. When you see a question like this, it's about data representation. You can use numbers. Okay. Now, name one statistical package that you can use for analysis of data in health studies. You know, we use SPSS commonly. Don't forget SPSS, statistical package for social sciences. You can use Minitab, you can use Stata. Okay, number 19, name 2 biological hazards of this group of workers. You can see these are surgeons. What are the hazards? 2 biological hazards. Transmission of infection like HIV, hepatitis. Okay, HIV, when there is a needle prick, needle stick injury, they can transmit infection like hepatitis, HIV. Okay, they can also have splash into their eyes. Okay, and it can also cause this infection that are mentioned. Now, indicate 2 types of non-biological hazard with a specific example of each. Now, biological, we said, is from infection. Okay. Biological hazard is from infection, from hepatitis, HIV, tuberculosis. Then non-biological could either be mechanical, from needle stick injury, or physical. Physical are due to exposure to radiation. Because in the theater, you could have the C-arm, okay, for delivering radiation. And usually they put on their protective devices, okay? Okay, name 4 types of curable sexual transmitted diseases. Curable, okay? And the second question says non-curable sexual transmitted diseases. The curable ones include syphilis, two, the gonorrhea, chlamydia, okay. Then you have the trichomoniasis. These are curable ones. Non-curable ones are HIV, HPV, hepatitis, hepatitis B, and herpes simplex. So let's quickly move on. What type of graphical presentation is this? Name two other methods of graphical presentation. This is a bar chart, but what type of bar chart? This is a composite bar chart. You can see multiple bar charts. Okay, this is a composite bar chart. Name two other methods of graphical representation aside bar charts, which could be simple, compound, composite. There is histogram. There is a simple bar chart. Another graphical representation is histogram. In histogram, you know it's continuous. There are no spaces. The genital ulcer of the patient shown is painful and the lymph node is unilateral and suppurative. What is the most probable diagnosis? You can see there's an ulcer there, and that ulcer is painful, and there is a unilateral suppurative lymph node draining that side. This is classical of lymphogranuloma venereum. You see ulcer with a suppurative ulcer of the adjoining draining lymph node. So you have lymphogranuloma venereum. Okay. Now, the next question says, what is the name of the organism involved? The name of the organism involved is Haemophilus. Haemophilus. How do you spell it? Yes. So, number 23, identify the practice. List 5 medical conditions associated with the practice. List 4 strategies of controlling this epidemic. Okay. This practice is what? Okay. Is cigarette smoking. List 5 conditions associated with this cigarette smoking. Now, of course, COPD, bronchogenic carcinoma, okay? Deep venous thrombosis, malignancy, several types of malignancy, okay? List 4 strategies of controlling the epidemic. What are the strategy of controlling this? Strategies for controlling smoking, cigarette smoking. So check that up. Black fly. What is the biological name for black fly? What is the biological name for black fly? The biological name for the black fly is Simolium damnosum. Simolium damnosum. Okay. What is the name of the insecticide of choice for this black fly? You call it DDT. Okay. Dichloro, diethyl, trichloroethane. DDT. Dichloro, diethyl, trichloroethane. Okay, let's proceed. I'll share the answers, you go through them. Number 26, it says identify the diagnosis. Mention 4 diseases that can present with this. This is shingles or herpes zoster. Herpes zosters or shingles. Okay, mention 4 diseases that can present with this. Patients with HIV/AIDS can present with this because it's commonly seen in immunosuppressive conditions. HIV/AIDS, patient with malignancies. Okay, steroid users causing immunosuppressive illnesses, malnutrition, so these are common immunosuppressive conditions that can present with herpes zoster. So in your options, when you see any condition that can cause immunosuppression, just pick it. Okay. The next question is, what is the distribution pattern of rash in the following condition? A, look at the distribution here. You can see here it's well concentrated in the face, the distal part of the limbs. Now, there are named distributions for various diseases like measles. You have a craniocaudal pattern. You start from the cranial portion and spread to the caudal. So for measles, the distribution is described as craniocaudal. For chicken pox is described as centripetal. Okay. You know, craniocaudal, it starts from the top and goes downward. For centripetal, it starts from periphery and moves to the middle, to the central. Okay. Scabies is flexural areas. Flexural areas. And smallpox is centrifugal. So smallpox centrifugal, while scabies century. Scabies is flexural areas. Chickenpox is centripetal, and measles is craniocaudal. Now, look at this diagram. Identify the diagram. Okay. Now, it says, look at over, you can see world population. You see China, India, United States, all represented on a pie chart. What is megacity? Okay, list 5 stages of demographic transition. Now, you should identify the diagram. It's a pie chart. This is a pie chart. It's a pie chart showing 12 most populous countries in the world. 12 most populous countries in the world. Okay, though this one has gone off. Now, what is a mega city? When you say a mega city is any city with a population of 10 million and above. That is mega city. Any city with a population of 10 million and above is described as a mega city. Okay, list 5 stages of demographic transition. Okay, the stages are high stationary stage, the early expanding, late expanding, low stationary, and declining. These are the stages. High stationary, early expanding, late expanding, low stationary, and declining. List 2 properties of this curve. Now, you can see this is a normal distribution curve. This is a normal distribution curve. You should list 2 properties of the normal distribution curve. Number 1, you should know it is symmetrical. It is symmetrical. 2, it is dome-shaped or bell-shaped. Okay? And 3 is defined by determining its mean and standard deviation. Okay, so it's a dome shape, symmetrical shape, and you can determine standard. If you remember, we said one standard deviation from the mean is 68%. Then you have 95%, then 99.5%. Okay, so they are symmetrical. What proportion of the population is covered in -2 to 1? What proportion is covered from -2 to 1? So from -2 here to 1, okay, you can see we have mentioned that you have here you have 60. It's usually less than 97%. Now, when you see this question, the most important thing you should know that it's a symmetrical, a dome-shaped graph. These three qualitative methods that can be used to obtain information from a community for healthcare planning. Qualitative. When you say qualitative, as we mentioned this morning, it is non-numerical. Non-numerical. Quantitative is numerical. So when you are obtaining information, okay, from a community, okay, using a qualitative method, you can use questionnaire. Questionnaire is a qualitative method. Questionnaires, 1, 2, okay, you can use observations. 3, you can use focused group discussion. So these are some methods of, okay, obtaining a qualitative information from a community for healthcare planning. You can use questionnaire, you can use by observation and by focus group discussion. The next question, name 4 impersonal method of health communication. Now you can use mass media, of course. You use radio, television, newspaper, internet, magazines. So don't be surprised you just see a newspaper on or a magazine on a picture test. It's a means of disseminating information, health information. Okay. That's 1. Who is regarded as the father of public health in Nigeria? Who is regarded as the father of public health in Nigeria? Dr. Isaac Ladipo Olawole, father of public health in Nigeria. Sir. Thank God you are in Ibadan. Who is the father of occupational health? The father of occupational health in the history of medicine is regarded as Bernardino Ramazzini, father of occupational health. Bernardino Ramazzini. Who is the father of medicine? I know everybody knows this. The father of medicine is Hippocrates. You'll soon be taking your Hippocratic oath very soon, inshallah. You can see him here, okay? Then who is the pioneer of vaccination? Is Dr. Edward Jenner. Edward Jenner, okay? State the steps of family planning counseling. Okay. I know you know all these ones. You have GADA. You can use your GADA. We don't need to discuss this. Maybe tomorrow we'll discuss this. What is the name of the lesion on the inside cheek shown indicated by the arrow? Where is the arrow here? The arrow is not clear. There is no arrow, but you can see all these whitish dots. Okay, this whitish dot is oral thrush. Seen in immunocompromised patients, in HIV patients. What disease is it found in HIV? Infection. When in the natural history of the disease does it appear? Okay. When the patient has AIDS, okay, that is stage 3. The patient have AIDS, they start having the acquired the oral thrush. What are these specimens? Though they are not very clear, okay, you can see they are food specimen. You see millet here, soya beans, beans, palm oil, millet, okay, rice. They are not very clear. They are samples of food items, okay? Look at a weighing scale here. Infant weighing scale. Give 3 common disease associated with the specimen, okay? You see, this can be very confusing. Though you see a scale here and these food items. Somebody is not eating, of course, they will have malnutrition, okay? They will lose weight. So they can have kwashiorkor. They can have marasmus. They can have vitamin deficiencies, we mentioned, and iron deficiency. You can see here, this is beta carotene, palm oil, vitamin A. This is protein, carbohydrate. So they can have energy, protein energy malnutrition. Okay. This is scrotal elephantiasis. And it is caused, what is the most probable diagnosis? Is filariasis. Filariasis. You have a very huge scrotal elephantiasis. It's caused by filarial worm. What is the organism? What organism could be held responsible? Okay, filarial worm, Brugia malai. Brugia malai. Okay. Brugia timori. What is the vector? Okay, mosquitoes are the vectors. Okay, this is something that occurs commonly, this overflowing. So common things that occur commonly, you should take note of them. What are 5 health problems that could occur? Okay. Okay, you see in overflowing, there could be loss of life, okay, drowning, Mention 5 mitigating steps that could be taken. Okay, you ensure drainage, adequate drainage. Who can tell us what this is? Though you are all muted. Okay, we have 3 more questions to go. So let me unmute you so that you will just interact before Dr. Mariam comes back and continue. Okay. I hope you are not sleeping. Let me see those who are. Yes. What 5 health problems can be associated with overflowing?
Loss of life.
I mentioned that one. You can't say it now.
Loss of properties.
Yeah.
Problem.
What associated
with flooding? The displacement of people, man. As I'm intending displaced person, you're not destroying houses, you're not destroying businesses, you're not destroying properties.
Health problems. Health problem. Businessman. They have mentioned loss of life.
Which disease is killing?
Yes.
Maybe disease outbreak.
Yes, disease outbreak. Yes. What again? When you have a lot of stagnant waters.
Disease outbreak like
Malaria, yellow fever.
Yeah, a lot of stagnant water. You have mosquitoes. What are other waterborne diseases? Okay.
Dengue, chikungunya.
What is this? Yes, who can answer this? Yeah. Yes, what is this?
This
I
looks
believe
like
this is not the first time you are seeing it. You just thought it's word art, go? You thought it's just design.
yeah.
It's a form of data representation. Look at it carefully.
Wait. New jobs.
Really showing a lot of things. Jobs. Okay, governments. America.
Education.
Word cloud.
Yes.
Advertisement.
Word cloud. Okay. What type of data presentation method is this? Is called word cloud.
Noted. Word cloud.
It's cloud. Just like cloud. Then B, list 4 method that can be used to obtain information from community for healthcare planning in this type of research. Four methods that can be used to obtain information from this from a community. Okay. Let me tell you one. Then you find out the rest. I'll send the question, all the answers you read. You have participant observation. Okay. What is this? What is this? Who can attempt?
Register.
Yes, who can attempt this, please?
Audio register.
It is written on it.
Pentavalent vaccine.
Chat.
Immunization card.
It's an immunization card now, immunization monitoring chart. You can see immunization monitoring charts. They are, you can see date is there, year is there, and all the months are there. So you call it an immunization monitoring chart. Okay. Interpret the illustration, okay, at the pointer red. That is this red line. Who can interpret this? Okay. Yes. Okay, let me allow you. You think when I send the answers, you now go through it. But be brainstorming. Mention 3 other information that can be obtained on this specimen. Yes. You are quiet. Okay. Who can answer this?
Animal slaughtering.
Of course, it's animal slaughtering. But look at behind him, there's another animal there now. So what do you think is going on?
An abattoir.
Yes, that is it now. It's an abattoir, an animal slaughterhouse. You call it slaughterhouse. Okay, so mention 4 hazards associated with the occupation. Yes.
Air pollution.
You said?
Infection like TB, the obvious.
Yes. Transmission of, what is that called? Zoonosis? Zoonotic diseases. But start with common one now. An injury. They can sustain injury both from the animal as well as from their equipment. Okay. Infection, zoonotic infection, worms, poisoning, and so on. Yes. Identify the specimen.
Woman in labor.
Yes. Yes, of course. Woman in labor, where? In her bedroom? Where?
Labor.
Labor room.
Now? Yes. So it's labor room conducting. They are conducting delivery in a labor room. Okay. So list 6 signals for CEOC facility. What is CEOC facility? COC, Center for Emergency Obstetric Care. what are the minimum you need in such facility where they can present emergency obstetric care. They can provide emergency obstetric care to maybe receive delivery. Minimum, they should have IV fluid. They should have IV antibiotics. They should have intravenous oxytocin, okay? Analgesics, removal of placental, retained placenta. They should be able to do that. Blood transfusion services. And of course, cesarean section. Now, these three bets, preparedness and complication, okay, readiness. 3 bet preparedness. You see some people after their wife delivered, 1 week they will come and tell you that they need money to buy RAM. So what is the implication? They did not prepare well, so they did not save money. So saving money is very important. Transportation. Wife is delivering 2 a.m. Labor 2 a.m. You can't transport her. Okay? Number 1, most importantly, you must have money. Number 2, there must be transportation facility. You can quickly take her to the hospital. Number 3, there should be donor. Not that you take her there, you are malnourished. Nobody to donate blood. You have to identify hospitals, good access road, and so on. So we've come to the end of public health session for today. And we are going to just take a 10 minutes break. Then we continue with the O&G from where we stopped. So if you have your questions, you can note them down. Before resuming, we will answer the questions. Thank you very much. So we are still using the same link to continue in 10 minutes.